This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about when to get your ACL fixed. If you like this video, we put out new content weekly, so please like and subscribe. So when I say get your ACL fixed, really what I mean is get your ACL reconstructed. There's some sort of newer techniques to actually fix the ACL, but most people what they're doing is they're taking either cadaver tendon, or they're taking your own hamstrings or quadriceps tendon or patellar tendon and they're reinserting it, basically reconstructing it. So when to get your ACL reconstructed? If you see an orthopedic surgeon that does a lot of ACLs, they're pretty much always going to want to reconstruct it. It's not always the right thing to do. So here's when you should get it and when you shouldn't. So if you find that after tearing your, so let me start with this. If you tear your ACL, you got to do physical therapy first anyways. You got to get that range of motion back, because if you don't get it back and then get your ACL reconstructed, you'll have a stiff knee afterwards. So whether you get it reconstructed or you don't, most people do physical therapy beforehand so they can get their knee strong and get it moving so you get your range of motion back. Now this can go one of two ways. If after doing that you still have pain in your knee feels unstable, meaning that when you move it, it doesn't quite feel steady, and you're having trouble playing sports or doing the activities that you want to do, like let's say soccer or basketball or football or skiing, then that's when you should get your ACL reconstructed. Basically, your knee is unstable, you can't do the activities you used to do, you might be on the younger side, it's worth getting your knee reconstructed so you can go back and do those activities, especially if you're competitive in sports. So what if you're not on the younger side and after doing the rehab your knee feels pretty stable and doesn't really hurt? Well, I don't really think there's a good reason for you to get it reconstructed. If you tear your ACL, you're going to get arthritis no matter what. They used to think that reconstructing it, you might not get arthritis, but you're going to get it. It's going to happen about 20 years after you tear it. And that's whether you reconstruct it or you don't. So if you can do therapy and you're on the older side, let's say you're in your late 30s or 40s or older and you tear your ACL and you do therapy and it's stable and it doesn't hurt, I wouldn't get surgery on that. If it was my knee, I wouldn't do it. Because what's the point? The only thing you might do is stiffen up your knee. And if you're not doing those activities where it doesn't hurt when you do activities anyways, I don't think it's really indicated. And you'll actually find a whole host of people that have torn their ACL and didn't even really know it. They might have had a bad sports injury and they took some time off and it essentially went away and they never knew about it. So we see that all the time. So basically, to sum it up, if you're young and your knee hurt, you tore your ACL and you've rehabbed it, and it's unstable and it hurts to do activities and you can't play sports, you should definitely get your ACL reconstructed. If you're older and you rehab it and it doesn't hurt and it feels somewhat stable, you are perfectly fine leaving it alone. If you want to get it reconstructed, then you certainly can, but you don't have to. It's got to be careful. A lot of orthopedic surgeons, once they see an ACL tear, they're going to want to reconstruct it. When you're in hammer, everything looks like a nail. So I hope I was able to answer questions about when you should get your ACL reconstructed. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond, but I can't give you medical advice about your specific condition. Again, if you like this video, we put out new content weekly, and thanks for watching.